You know, the company itself is being pushed, and rightly so, to demonstrate our value to payers and providers. You know, we're getting more conversations now around, can you demonstrate your outcomes? And of course, in the United States, we're moving from this cost to quality to outcomes to population health, which means that you know, we're proud to stand by the effect our medicines have and what that means for the long-term medical cost offset and the best use of the healthcare dollar in the United States. And that requires a few things. It requires us being prepared to stand by our data and to be able to use that as a marker for what we think outcomes would be. It requires the patient to play their part in you know, complying, adhering, and a lifestyle change. And it really requires the payers and providers, to a certain extent, to provide an environment where you can actually work long-term together on things like type 2 diabetes. So you know, you could almost envisage a time where you know, you bring all the mechanisms to a provider like we could and say, well, let's work together on your population. Let's give, you know, let's create an environment where you have complete clinical freedom to be able to use whatever or however, because of the individualized nature of the patient's needs, and then judge us by the value we bring, either in HbA1c drop today or other medical cost offsets in the future, and then be proud of that long-term working relationship, be transparent about it, and then be recognized for it, both through real-world evidence setting, which is, you know, a wealth of evidence emerging as we speak, and also for you know, the most sensible use of the healthcare dollar in the United States. And I think we like to play a part in the value delivery as well as the affordability for patients, because it does change what we do. You know, I've had the great privilege of leading AstraZeneca in Japan before I was in the United States, and indeed in Spain before that, and working in the UK. And I've seen different healthcare systems, you know, tackle the value question in very different ways. What I do know is that we need to work with the regulators and we need to work with the authorities to make sure that if we come in on a wave of trying to help deliver value to a large population and make interventions in terms of educational or screening, then you know, it has to be a longer term relationship than perhaps currently contractually that you would have, and it has to be one of complete openness and trust, and it must allow us to bring services forward that are for the benefit of the patient, that aren't misconstrued as us donating, or you know, if a decision has been made to use medicines in a certain way, we want to support the best use of them. And you know, I think currently through legislation in the United States, that's not an easy thing to do. So we want to make sure that we can bring through programs, products and services that deliver on population health objectives, that do it in a way that is respected and acknowledged, that the patient itself plays a major role in also, and that you can look back and think that was a very good working relationship that led to something very good. It's very unique by nature. You talk to any of the payers and the providers across the United States, their needs are all just slightly different. And of course, at AstraZeneca, we're proud to be in diabetes, we're proud to be in oncology, we're proud to be in respiratory disease and cardiovascular disease. So we get to explore different executions of value-based delivery systems in different therapeutic areas and on different medicines. And you know, I see it only growing, and I see us being one of the leading contributors to making those things work, and we're underway. It's going to take some work to get there on that, but that ultimately changes the nature of what we do every day. So we spend more time educating and more time communicating because you know, we know what we're all trying to achieve on a, you know, a joint agenda. And I think that's for most of the people, if not all the people in the industry, certainly all the people in AstraZeneca, you know, that's a very healthy place to be working in our industry, trying to do the right thing for patients. And you know, I would say that's the most fun we could possibly have in our jobs. Well, I have, and you know, we've set on our way in 1 or 2 therapeutic areas, different approaches to this theme, and you know, we're enjoying it, because I'll tell you why. As physicians go from fee for service to becoming part of integrated healthcare delivery systems and solutions, you finally have a chance to say, if we make an intervention here, what does that mean in terms of medical cost offset over here? And what does that mean in terms of population health? It's when you have, you know, the complete continuum of a patient's care that you recognize where it's worth investing in trying to alter the course for a positive outcome. And we're doing that in acute coronary syndrome, we're doing that in cardiovascular disease. And, you know, there was a fantastic article printed just very recently in the Journal of Managed Markets where Cigna shared the use of Crestor in lowering cholesterol. And what they did, it was really very clever. What they did, if you went to get your lipids checked and you were very high on LDL, if you had other high risk factors, could be age, lifestyle, different things of hereditary nature, you were pre-authorized to get Crestor before you even were given the prescription, so that when you took your results to the physician said, I got it, that's great. Why? Because for high risk patients, they wanted to get the right medicine to the patient as fast as possible. And what they've demonstrated is you know, the first stage in an improvement in outcomes. And I think that's kudos to them, quite frankly, but also we were open-minded enough to say, let's do it differently. However that looks, let's do it differently and demonstrate our value. And of course, the right patient populations are where we start, and in the Cigna case, that's exactly what they went after. And it's been a very good learning experience.